flattening the curve keeps society going. Now, that seemed like a sensible argument. It made sense. We made the same case on this show repeatedly, but we were wrong. For reasons that still are not clear, the models that our authorities use to make key public policy decisions, those models, by the way, already had the effects of a lockdown factored into them. Those models turned out to be wildly inaccurate. They massively overstated the number of patients who would need hospital beds. In some cases, their estimates were off by nearly a full order of magnitude. That error was great news for the country. It was an unexpected blessing in the middle of an unfolding disaster. But it was also a moment to rethink the policies we had based on those models, the ones that were wrong. We never did. Instead, our leaders pulled a bait and switch. Without ever acknowledging the change, they began to tell us that the real point of quarantine was to defeat the virus itself. On April 8th, the Washington Post announced that, quote, flatten the curve had become crush the curve. Quote, we should not end social distancing and reopen the economy until we know the infection rate is nearly zero. Nearly zero. So when will that be exactly? And the answer is nobody knows, possibly the rest of your life. Dr. Anthony Fauci announced last week that shaking hands with other people, an ancient and deeply ingrained custom that's been ubiquitous in the West since at least the 5th century BC, may have to end forever.
I don't think we should ever shake hands ever again, to be honest with you. Not only would it be good to prevent coronavirus disease, it probably would decrease the incidence of influenza dramatically in this country.
So banning handshakes, that's a big move. Only a terrified nation would even consider something that radical. How afraid of this pandemic should you be? That's a central question right now because it defines what we should put up with. One way to consider answering that begins with a look at mortality rates. Death tolls tend to be the most accurate numbers in social science, if only because whether or not a person is alive generally is not a subjective question. We all agree. So let's start with the numbers from New York City, where the epidemic has hit the hardest so far. And most people think these are pretty complete numbers. As of yesterday at 5 p.m., according to the New York City Department of Public Health, a total of 6,182 people had died of coronavirus in New York. That's a big number. It's more than twice the total killed at the World Trade Centers on 9/11. But look carefully at the chart. It's right online. You can pull it up. Of more than 6,000 fatalities, a total of only 128 had no known underlying health conditions when they arrived at the hospital. Now, New York is specific about what those conditions include, and it's helpfully at the bottom of the chart. Diabetes, lung disease, cancer, immunodeficiency, heart disease, hypertension, asthma, kidney disease, gastrointestinal, and liver disease, end quote. So the longer you look at these numbers, the more consequential those underlying conditions appear to be. Relatively few young and early middle-aged New Yorkers, for example, have died so far of the coronavirus, a total of just 222. That's between the ages of 18 and 44. Of this group, only 26 of them had no identifiable underlying health conditions. The rest did. Almost 10 times as many elderly people died of the coronavirus so far, a total of 2,114 New Yorkers over the age of 75. Yet of that group of very older people, only 25 of them had no underlying conditions. In other words, underlying health conditions appear to be one thing that the oldest and the youngest victims had in common, maybe the only thing. Interesting. And we should be clear, these numbers could change. We still know so little about this disease, despite the impression that the people in charge often give you. Just today, for example, a study emerged showing that cigarette smokers were for some reason less likely to die, much less likely to die of coronavirus. Didn't think we'd be reporting that on the air, but we're learning new and unexpected things every day. As of right now, though, it does seem like we can conclude with some specificity who is at risk of dying from this disease. And the answer is people with serious underlying health conditions, especially elderly people. According to an analysis by former New York Times reporter Alex Berenson, it seems likely that more people over the age of 100 have died of this virus than people under 30. So in the face of that evidence, and it's fairly constant across countries, why don't we let science drive policy and proceed with that in mind? Instead of locking down the entire country, why not spend our time and our money working to protect those we know are vulnerable? That's how rational countries behave in the face of risk. In fact, it's normally how this country behaves. Think of it this way. Hundreds of thousands of women get breast cancer every year. About 42,000 of them die from it. You probably, unfortunately, know some. Based on those numbers, doctors recommend that women over 40 get regular breast cancer screenings. But as it turns out, women are not the only victims of breast cancer. This year, about 2,600 men will also get breast cancer, and an estimated 520 of them will die from it. That's not an insignificant number. In fact, according to the latest CDC figures available on their website tonight, that number is more than twice the total of coronavirus deaths for all Americans under the age of 45. That's as of April 11th. Yet we still don't screen all men for breast cancer, and we're not going to. Not because we don't care about them or grieve their deaths, we do, but because overall breast cancer is not statistically a significant threat to men. At the same time, many other things are. Lung cancer is, prostate cancer is, heart disease is, and so instead we focus on mitigating those. It's a question of balancing risk with cost, and you have to do it if you're going to solve any problem. If we screened all men for breast cancer, we would have fewer resources to screen all women for breast cancer, and women are the ones dying from the disease in large numbers. Does that make sense? Does it sound rational? It probably does. And yet, what if you said that out loud and a brigade of 27-year-old narcissists on Twitter began screaming at you that you don't care about male breast cancer victims? You've got their blood on your hands. You want them to die because you're a servant of Wall Street. What would happen if that cacophony started? We'd probably stop talking. In an environment like that, clear thinking would be impossible. And that's where we are now. That's how we've arrived at where we are tonight. Tens of millions of Americans forced from their jobs by government decree. By taking their livelihoods, we have ensured that some unknown but probably significant number of them will die. They'll die from suicide, they'll die from alcohol abuse or drug ODs or heart disease. Mass unemployment kills people, that is beyond dispute. The median age of American employees is 42. The risk to healthy 42-year-olds from this virus is extremely low, far lower than dying from suicide, alcohol, drug OD, or heart disease. So why not spare those people and let them work? Why are we crushing them? If you're going to quarantine people, why wouldn't you quarantine those who are at greatest risk, especially if you have some good sense of who they are? And we do. We balance imperatives in public health all the time. According to the NIH, the death rate from the smallpox vaccine historically has been about 1 in every million vaccinations. We consider that acceptable, and it is. But it's considerably higher than the death rate from coronavirus in this country for people under 45. Now, to be clear, we are definitely not arguing against the smallpox vaccine. Obviously, it's one of the reasons life expectancy in the West has risen so high. We are strongly for it. But there's a point, an obvious one. A crisis like this requires rational decision-making. And so far, our leaders are clearly not capable of rational decision-making. And that's bad. Justin Haskins is editorial director at the Heartland Institute, and he joins us tonight. Justin, thanks so much.